Well, hello everyone. We're here today for our third webinar uh, on health systems and medical education across the globe. Today we have representatives from Tunisia, from Palestine, and from Jordan to speak about their countries. And first of all, we're gonna present a bit of our own Brazilian system. Monique, if you could please start.
Is my I don't okay. Uh, just remember that we will give the certificate for those that participate of 3 of the 5 of our webinars. So don't forget to fill the forms we have in the descriptions of YouTube. And today we have 3 countries represented here. We have Tunisia, we have Jordan, and Palestine. So yay, it's amazing. We will introduce the presentations when they came. So I will start with the Brazilian presentation of our health systems. As usual, we are the first just to introduce, and I will be really fast because most of our students already see like this is the third time they are seeing, so maybe they're tired of me, but people here maybe haven't seen, so that's why we do it all the time. So you can see my screen? No, right?
Yes, we're seeing it.
Okay. So it's not passive. Okay, so in Brazil, our health system is called SUS, that in Brazil stands for Sistema Único de Saúde, or Universal Healthcare System in English. It's public and it's free, and its principles are universality, equity, and integrity, which means that everyone in Brazil, like not only Brazilian, but everyone in Brazil has the right to be assisted. If you're not from Brazil, if you're here just traveling, you will be able to receive medical help uh, for free and public, of course. So, but only emergency. Like you won't be able to have like first cares, uh, basic care health, like help, because that's you need to live in Brazil. So even if you're a foreign living in Brazil, you have the right to be attended uh, on the basics healthcare units. And it's distributed effort according to the local necessities of each region in order to provide an adequate support to everyone. So if one city needs more orthopedics care, then they will have more orthopedics than other cities because the other cities maybe don't need that kind of uh, attention. So they try to provide the help what the community need the most, so everyone have the equal right to the health, and every person must be seen as a whole or in the right to have all the questions fully addressed, and not only because of your symptoms. Like if I go to the doctor because of a headache, they will check me like everything, not only my headache, because maybe I have some other problems that might interfere or something else that also need to be take care of. Like maybe I have high pressure and I don't know, so they need to find out that I have something and start treating me to like don't get me to get sick. So that's why we want to see the person as a whole and fully address it, so we can treat it before the patient gets sick. In order to do so, SUS is not restricted to the healthcare assistant. They have having a major role in articulation actions with other fields like education and work legislations that ensures health promotion and prevention. The healthcare system is organized in 3 instances, so the national, state, and municipal authorities, and they're all responsible for managing the finances and assistance with make it joint action. So all of 3 are responsible for the system, and all of the 3 need to put money on it. So the money they receive, they give part to the system. And like depending on the, like for example, for the municipal, maybe not all municipals, they will put the same amount of money. That's why maybe some cities have better healthcare system than others, but it's what the mayor wants to do. So it's what, yeah, like, but they all need to manage the system. And the healthcare hierarchy is also divided as it is organized in three levels of our system. So primary care, which is family medicine, the secondary care, which is ambulatorial, and the tertiary care, which is hospitalization. Uh, the primary system is organized in basic health units that encompass the majority of the city extension. So for example, we have here a map of our city, and each color in this map represents an area in the city. So each color would have a UBS, the basic health unity, and this basic health unit will have like maybe 5 or 6 teams, and each team will be responsible for like 100 of family, and this team will have a doctor, uh, they have a nurse, they have, I will give like, they have dentist, and I will say all the person that help this team, that are part of this team later. So they have like a few families that they support and they take care, and they like do the thing, like they follow up for the family to see if they need something before they actually need. Um, so every UBS is structured with a multidisciplinary team with a doctor, a nurse, a dentist, a community health agent, and also serve as the major entrance door to the whole system. So if you need to get like a specialized care, you need to first get into the UBS, pass to the general doctor, and then they'll say, okay, I cannot really help you here, then you need more specialized doctor, so you go to this other doctor, and or you need to do these exams. And it's by entering in the UBS that you have access to the like the tertiary level or the secondary level of the healthcare system. Of course, if you need like some urgency, you will be going directly to the hospital. But then for follow-up, you need to start with the UBS. In order to do so, every city is divided into sanitary districts that have power to regulate their own primary health care, defining the distribution of UBS in their territory. One of the most important features in SUS is the popular participation. So everyone can and should participate on the system's decisions taken in the process. So for example, they have a conference to discuss the laws, what the SUS will do, or what is the right of the SUS, what they must do it for the community and everything. And this population, the persons, like each person in the community should go participate in these decisions, and like they have the right to do it. They have a voice, so they can like go there and ask, my community need more of this or more than that, and we don't need this. And like they can fight for the rights of what their community needs for more. So for that, we have health contests and health conference that every person can take part despite their academic titles. They don't need to be doctor. They can be just like a normal person that live in the community. They can go there and have a voice for it. You don't need to be doctor, nurse, or anything in the health related. This way, everyone can help by suggesting strategies and controlling and evaluating the execution of health policy since the UBS level and reaching the national sphere. So now I'm talking about the medical education. Here in Brazil, we have a 6-year course that's divided in 3 blocks. So the first 2 years is the basic cycle and contemplate studies like they have areas as anatomy, biochemistry, like these basics areas. And then in the third and fourth year, we have clinical circles that we have more specialized specialized areas like cardiology, pediatrics, endocrinology, and all these medical departments that is not basic, is like already clinical. And we go more to the hospitals, like to have practice in the ambulatory and maybe in the infirmary, but we also have classes. And in the last 2 years of our medical school, we have internship cycle. So like we have really almost nothing classes, and we go every day to the hospital as an internship, like really internship and practice in all the areas. Like mostly we run in pediatrics, gynecology and obstetrics, general surgery, internal medicine, and all specialties, public health, and emergency. Some universities also include rotations in mental health, and others have programs in rural zones too. They call rural internship, but it's not all of the medical, like it's not compulsory, so not all universities have it. But it's really nice to see like the rural internship and everything. These rotations are now remunerated and are obligatory for getting the medical degree, including exams at the end of each. So every cycle you have, like if I go to gynecology and obstetrics this month, at the end to pass, I will do exams and pass to the next area of my internship. And that's it. So thank you. And our next guest will be Loda from Tunisia. I will give her the word. You can start talking while I try to open here.
Okay, I can wait. Just would you please share the presentation?
I'm trying. Wait. Can you see it?
Yeah, but just can you make it bigger? Like
I'm
full
trying.
screen?
Like
Okay.
Now it's loading. Yes.
Did it work? Because it didn't change in my laptop. No.
I think this is taking a while, but it will change. I hope so. It's really cute. Now it should work.
I can. If this work with you, I can start, or should we
Maybe
wait?
they will change in a while because I can see the whole screen, but in YouTube not. Sad.
Okay, we can start with this if you want.
No, because oh wait, I will try to share again. Oh god. It's just not going. I can try to do on PowerPoint, but your animations is not gonna work.
Wherever you want.
Wait, I will interrupt here just to try something.
Okay.
Yes, now it works.
Okay. first slide, please. Okay. Hello, everybody. Aslema. First of all, I want to thank DENEM Brazil for the invitation, and also I want to thank you for attending this amazing webinar. I'm so excited and so happy for presenting Tunisia today in front of you. So I'm going to start with representing myself. My name is Khouloud Bnouni. I'm 23 years old, medical student from Monastir and currently living out of Associa-Med. I'm also medical education trainer, and that's it. Since we are done with the get to know me part, I want to present our table of content for today. First, Tunisia overview. I think that I can't start with the webinar without giving you interesting facts about my beloved Tunisia. Then we will move to the main 2 points of the agenda, which are healthcare system and medical education. And finally, the question part. Next. Next, yeah. As you see in the map, Tunisia is a country of North Africa. Its accessible Mediterranean coastline and strategic location have attracted conquerors and visitors throughout the ages. Before the country was created, the area was called Ifriqiya or Africa. Arabic is the official language, and most natives speak dialect of Tunisian Arabic. Tunisia is Tunisia's culture is highly diverse, in part because of the long period of Ottoman and the French rule, but also because of population of Jews and Christians have lived among Muslims majority for centuries. Food is spicier than the rest of Arab world, especially shakshuka and couscous. You must try this. Matmata is a place in Tunisia where people live in underground houses. Tunisia has one of the world's largest amphitheaters, El Jam, which is the third largest Romanian ruin in the world. Tunisia is the women's rights champion in the Maghreb region. And finally, Hassan Aqaba Garbi is a Tunisian professor in radiology and biophysics. He made the Garbi ultrasound classification of high dated cysts. Yeah, so I hope you find these facts interesting. And let's move to our first main topic, which is the healthcare system. Tunisia set the health sector as a national priority since independence in 1956 and has pledged to provide free health services for the low-income population. The Tunisian healthcare system is showing now important assets that have been accumulated over decades as a strong public service with the advanced medical capacity and healthcare supply, developed and diversified private sector, and a reputable and effective health education system. Next. What cover does the Tunisian healthcare system provide? The health system model is represented by 3 levels of care. Primary, with the network of 81 clinics in 2,091 basic health centers, which deal mainly with the problems of the population it serves. Secondary, with this slide. Secondary, with the 109 district hospitals that provide specialized diagnostic and treatment. And tertiary, with the 33 regional hospitals and 24 modern teaching hospitals, with the mission to provide hyper-specialized healthcare and to assure teaching and to conduct research. Next. Who manage this system? Actually, the health system is governed by the Ministry of Health and by its regional health departments. The National Health Insurance is the biggest insurance in the country as it refunds public services as well as private services. The National Council of Physicians aims to keep the profession's moral interests and to defend its values. The Council aims also to guarantee the respect for deontology and ethics. Next, about healthcare facilities, the public sector remains by far the primary health cover provider in Tunisia, accounting for 87% of hospitals' bed capacity, with the 20,488 beds compared to 5,020 beds for private clinics. The geographic distribution is characterized by regional disparity. In fact, 42.2% of doctors are located in the capital Tunis, which is inhabited by 21% of the population. Also, most of the specialized departments in hospitals are located either in Tunis or the coastline region. Next. As for other facilities, we can talk about the screening programs, colorectal, breast and cervical cancer, newborn metabolic or congenital diseases. There are also many public health campaigns such as health eating in school or organ donation, etc. And also, since its independence, the Ministry of Health has made various national programs that aim to tackle the most urgent public health issues. I can give you examples like the National Program of Fighting Cancer, the National Program for Hypertensive Patients and Diabetes, the National Vaccination Program, and the National Tuberculosis Control Program. Next. Public quality of health, but is it better in public? Most patients who choose the private system are looking for shorter waiting times, luxury services like individual clinic rooms, unlimited time visits, etc. But also the quality of public sector may be compromised as the hospital is usually overloaded and the number of available skilled doctors is not enough. But critical and serious cases are mostly transferred to the modern teaching hospital, as they offer multidisciplinary staff available 24 hours. Next. The last part of the healthcare system is the public-private partnership. In a context of economic difficulties, the Tunisian government is required to find solutions to meet the expectation of the population. The current challenge in the Tunisian health sector is how can public and private sectors combine and harmonize their efforts to achieve common interests and objectives. The public-private partnership is a process helping the state to involve private investors in the realization of public interest projects and develop long-term contracts. So the two sectors will share resources and technical expertise and will access to further advantages. However, it is essential to establish clear and effectively legal and institutional frameworks governing private participation in the public sector. Well, I hope that this wasn't so complicated. I will wait for your questions later, but now we can move to the medical education part, which is easier than the previous part, I guess. Well, in Tunisia, education is free for all Tunisian citizens and for foreigners who have scholarship. Admission is bound to the success and the score in the Tunisian baccalaureate examination. The admission score is very high, based on competition among all applicants throughout the nation. Medical school curriculum consists of 6 years, 5 years as extern, and 1 year of internship or as intern trainee. And there are 4 medicine faculties, situated in the major cities of Sfax, Sousse, Tunis, Monastir, and Tunis, which is the oldest one. Next. Okay, the medical school curriculum is divided in 3 cycles. The first medical education cycle is composed of 2 years of medical theory containing all basic sciences related to medicine. At this level, the curriculum is more focused on theoretical than on practical learning. The second medical education cycle has 2 parts. The first 3 years, during which the student receives both theoretical and practical training with a total immersion in the hospitals and in the hospital environment. It consists of clinical issues related to all medical specialties. Here, the student in total have studied 5 years, finish exams in June, and have a revision period from July to December, and then set for national medical exam. For the second part, the 1st of January, the Tunisian medical student started a new experience, which is the internship. He is considered as a physician, but under the supervision of the chief doctor. The student rotates over the major and most essential specialties during a period of 3 months each. There are 2 mandatory departments, which are pediatrics and gynecology. So all interns must pass through these 2 departments and 2 other faculty departments. Also, interns get paid 1,180 dinars, which is around $420. And the last part, which is the third cycle, is the residency. To enter this last cycle, student must pass the national residency examination. The residency program consists of 4 to 5 years in the specialty he qualifies, depending on his score in the national residency examination, under the rule of highest score chooses first. Next, the graduation, which is the last part and the last good thing. Yes, graduation. Keep this slide. Thank you. For those who didn't pass the exam, they have to retake the exam again and pass it, otherwise they can't get graduated. I can imagine that you are surprised or maybe shocked now, but yeah, it happens. You study 6 years, but sometimes you can get graduated. Whether the student chooses to be a family doctor or a specialist, he has to make a doctorate thesis, which he will be defending in front of the jury, after which he gains his degree of doctor of medicine. This was the last part of my presentation. I hope that you enjoyed it, and I hope it was clear too. And I'm here if you have any questions, so just send it to me. Please don't send me hard questions. Thank you so much for your attention.
Thank you, Loda, for your amazing presentation. It was really amazing. And now we are going to our second country, which is Palestine, with Hannah and Abdallah. I hope it's right. I'm sorry if I'm not, but you can share your presentation and start it.
I cannot share my presentation right now. Please tell me it's on.
Not yet.
Can you see it?
Now.
Okay, great. First of all, how are you? I'm Hannah Khalili. Thank you for your invitation. I'm the National Exchange Officer of Palestinian Medical Student Association. Today, I'm gonna get you more familiar with the Palestinian healthcare system. Hopefully, I'm not gonna take long. Well, today I'm gonna talk about a general introduction, the organization of the healthcare system, general info about the health status in Palestine, major challenges, and a bit about the developmental plan. Okay. The number of Palestinians in the world are 12.7 million, distributed according to place of residency by 4.88 million in the state of Palestine, meaning that there are only 38%, 38.4% of the total number of Palestinians in the world. Now, those 38.4% are living in two compartments, the West Bank, including East Jerusalem and Gaza Strip, these are the lands that are controlled by the Palestinian National Authority. Despite, Despite facing a lot of challenges like widespread poverty, high prevalence of lifestyle risk factors, vulnerability to hazards, some health system weaknesses, difficult access to healthcare, our key health outcomes in Palestine show better than average in the Eastern Mediterranean region and are similar to those of neighboring countries. Now, going to the next slide. Organization of the healthcare system. We have four major health services providers in Palestine: the Ministry of Health, UNRWA, non-governmental organizations, and private or profit providers. Well, let's talk a little bit about them. Ministry of Health providers provide primary, secondary, and tertiary health services and purchase the unavailable tertiary health services from domestic and abroad providers. The Ministry of Health seeks to improve the health status of Palestinian society by promoting individual and community health, ensuring the provision of comprehensive, high-quality health services to all citizens within the available potential and resources, of course, enhancing the education and community awareness programs. Second provider is the UNRWA, which provides primary healthcare services mainly and only for refugees. It can purchase secondary services, but only for hardship cases. NGOs also provide primary, secondary, and some tertiary services. The same goes for private sector, but private sectors focus more on the specialized hospitals and investigation centers, meaning the tertiary healthcare services. Okay, let's go on to the health status in Palestine. As you all know, the vaccination coverage levels are one of the best indicators of the health system performance. According to WHO reports, more than 90% of children in Palestine are vaccinated, which reflects good compliance in the area of pediatric primary healthcare. While notable in Palestine, there are two main providers for vaccination: the Ministry of Health, responsible for the general population of the West Bank and Gaza Strip, and the UNRWA is responsible for the Palestinians who have refugee status. Second, the infectious diseases. In recent years, the Ministry of Health has achieved a remarkable success in controlling several infectious diseases. For example, there is no cases of leprosy or diphtheria since 1982, no cases of polio since 1988, and no cases of rabies, cholera have been reported despite the presence of these diseases in neighboring countries. Well, unfortunately, when infectious diseases are controlled and reduced, chronic diseases are on the rise as a major cause of morbidity and mortality. The increase in chronic diseases is associated with changes in lifestyle, behavior, physical inactivity, and poor eating habits, just like other developing countries, which means more rates of cancer, cardiovascular diseases, diabetes, and mental disorders. Going to the health insurance, I'm very glad to say that approximately 78% of Palestinian population living in the West Bank and Gaza Strip is covered by some form of payment for healthcare, according to the data from the Palestinian Central Bureau of Statistics. Well, same as the vaccination, the main providers for the health insurance are Ministry of Health and UNRWA. They provide now about 90% of the coverage. Well, it's noteworthy to say the coverage of the population of Gaza Strip by health insurance is 100%. We have many types of insurance like compulsory, voluntary, insurance of workers within the Green Line, group insurance, and insurance of social affairs, and prisoners insurance. Okay, going to major challenges. Okay, first we have the barriers to access. Well, hospitals in the West Bank and Gaza Strip are sometimes not equipped to deal with more advanced medical problems and procedures. In such cases, doctors will refer their patients to more sophisticated treatment centers in Israel. Such referrals are often delayed by Israeli bureaucratic process, which has to be approved. Now, ambulances traveling from Palestinian territories to hospitals in the East Jerusalem are often delayed or denied at security checkpoints. Well, moreover, within the West Bank, mobility is limited. Residents must pass through Israeli checkpoints in order to travel between towns in West Bank cities, meaning that residents have trouble accessing healthcare providers located in other nearby West Bank towns. This limitation is even more serious in emergency situations where ambulances traveling between West Bank towns experience delays. Secondly, worsening violence and inability to safeguard the security and human rights of the population, deep-rooted political uncertainty, economic contraction, and the Palestinian public finances are dependent on foreign aid to a significant extent. And despite increasing needs in the past years, aid for Palestine has declined. For example, it dropped like 30% in 2015, meaning that the volatility and withdrawal of aid severely hindered the government's capacity to allocate resources according to its plans and constrain its potential to embark on long-term ambitious reforms. Well, overall, health outcomes are reasonably good, showing the resilience of Palestinian and the health system. But more reform and rationalization of the health sector, as well as sustained financial support, are necessary to ensure durable and sustainable health system development. And talking about development, I'm going to talk a bit about the National Policy Agenda of 2017 through 2022. The government has embarked on the formulation of new national policy, defines quality healthcare for all. It has two priorities: provide comprehensive healthcare services for all and improve citizens' health and well-being. Its main objective to ensure the provision of comprehensive healthcare services, promote programs of non-communicable disease management, preventive healthcare, community awareness, and gender issues, enhance health governance, including enforcement laws, legislations, cross-sectoral coordination, enhance health financing, and improve financial protection of Palestinian citizens against health costs. And that's the end of my part. Thank you all for listening. And I'm gonna give the mic to Abdullah to talk about the medical education in Palestine.
Yes, my voice is clear. Juliana, Monica, Hannah.
Yes.
Yeah, sorry. I have a problem turning on the mic, but yeah, clear.
Okay, perfect. Hannah, can you share my slides?
It's already on, I think.
Can you make it full screen if you can, or
Just a minute.
okay.
Is that good?
Okay, it's okay. Hello everyone, my name is Abdullah Ramadan, the National Officer on Research Exchange at Palestinian Medical Student Association IFMSA Palestine. Actually very proud to be with you in this webinars and talking about medical education and health system in our country and share it with other countries all around the world. And I really would like to thank Hannah and Juliana for this wonderful opportunity. Also, thanks for Hannah, our NEO, for her presentation about health system in our country. We're talking about medical education in Palestine. Next, Hannah. Palestine is a spot of wars and conflicts. Ongoing tragedies caused by the occupation has affected its state of dependency with a negative impact on every single sector in the community. Education sector is one of the biggest sectors that has been affected by this situation. The area which was known as historical Palestine has always been in the lead and a minorate for various sciences. However, the recent history was impacted by a gap due to the previous mentioned points. Medical education field was recently moved in our nation. The first medical school was Al-Quds University, which built in 1994. After that, other four medical schools were built, following were four medical schools were built following Al-Quds University. So we have five main medical schools in Palestine. In this webinar, I will tackling the main two schools in each region, Gaza Strip and the West Bank. In West Bank, we have Al-Quds University and Al-Najah University, as you see here. Firstly, Al-Quds University, as I have mentioned, it is the first medical school established in Palestine by the previous Palestinian president Yasser Arafat, if you know him. Didn't know. Okay. Uh, who dreamed to make a university in the capital of Palestine, Jerusalem. Actually, Jerusalem and Quds University are both politically and symbolically significant to Palestinians and the Palestinian identity. Regarding Al Najah University, it has been started in 1999 as a department that teach basic medical sciences as a sub-institution functioning under the facility of medicine at Al Quds University. This is still until 2006. After that, the university has separated and started offer both basic medical program and the clinical medical program. Talking about Gaza Strip, there are two medical schools, Al Azhar University and Islamic University. Al Azhar was established in 1998 as a branch of Quds University Faculty of Medicine until now. So basically, when you graduated, you will get two certificates, one from the Azhar and the other from Abu Dis, and this is my university. The Islamic University, and which is the newest medical school built in Palestine, and it started functioning in 2006. Next, Hannah. Hannah, next. Okay. We have over 3,500 medical students. Our medical schools, they are three of them are private, one public, and the last one is non-governmental. The medical program consists of 6 years. So when you complete the whole program successfully, you will certified with the pleasure of medicine and pleasure of surgery degree, which is MPCHP. After that, you need to pass it through the internship year, which I will talking about it later. To conclude, the medical education system in Palestine consists of 6 years, 6 years medical program plus one internship year. Next, Hannah. Okay. Talking about the medical program, it's divided into two phases or two stages. The first 3 years are combination of basic science and very clinical medicine, in which students teach basic medical sciences courses, including anatomy, histology, pathology, pharmacology, and other basic courses of 3 years. But next, Hannah, please. Okay. As I have said that in this basic stage, they're learning anatomy, physiology, pathology, pharmacology, and other courses. And the methodology of teaching depending on lectures, simulations, and practical labs. Um, some schools mix this phase with the clinical one, as in Najah University. It requires to spend one day per week in the third year in a clinical setting in order to get the student introduced early to the clinical environment and to be ready for the next stage. But there is other university such Al-Quds University and Al-Azhar University. They offer a 2 month bridging course at the beginning of the fourth year, which marks the second phase of the medical program. And the bridging course provides some basic clinical skills such as history taking and examination. Next, Hannah. Uh, okay. The second phase is the clinical one from the fourth year to the sixth year. During this phase, students are introduced to various clinical courses such as internal medicine, surgery, pediatrics, OB and gynecology, and other subsystems. Um, Hospital rotations consist of theoretical lectures, hands-on training of clinical skills, and soft skills training as a communication, which is very important. Clinical students spend their rotation with different institutions, governmental or private institutions, scattered throughout the West Bank or in Gaza. Um, some nominated doctors within these institutions are paid by the medical schools in order to supervise and teach the students. In addition, the hosting institutions or hospital are also paid annually. Next, Hannah. Assessment, how we assess here in Palestine. The assessment methods are different between the basic years and the clinical ones. In the basic stage, the assessment depends on the written exams and at the middle and the end of the semester. But in the clinical stage, depends on written exams, oral skills, and these written exam those keys are at the end of the year, and along the year there was observation during the rounds. Um, One of the graduation requirements here is to do a graduation project and this is mainly a research project with a group of your colleagues. And it's got to mention that Al Najah University gave each group $1,000 to assist them in this graduation project. Next. Okay. After medical school, doctors traditionally complete a 1 year internship, and this internship where they move to a different specialty every 2 months. And all internships include medicine, surgery, pediatrics, OB and gynecology, psychiatry, and pediatrics and public health. However, in 2012, the system was changed to allow Palestinian graduates to begin a residency program immediately after medical school if they choose. Mm, the residency program in Palestine in 2011, the Palestinian Medical Council, PMC, has initiated a national residency program for medical specialization in cooperation with the Ministry of Health, MOH, and different private health institutions. Mm, BMC provides a comprehensive training modules in various medical specialties, sets up standards for accreditation of of training hospitals, and eventually it is responsible for assessing the enrolled physicians and certifying them. About the available residency program in Palestine, it's internal medicine, surgery, pediatrics, ophthalmology, ob and gynecology, orthopedics, oncology, and family medicine. After the duration of and so the duration of residency program here in Palestine lasts between 4 to 5 years, depending on the specialty. However, there is a lack in subspecialization programs. They are not being offered locally. For example, there are no specific program in respiratory or renal medicine. So, doctors who aim to complete additional subspecialty programs strive and struggle, and eventually they are forced to travel abroad to get the chance. Next slide, Hannah. Here is in the pictures in the left. The previous one, it's a group of the Palestinian medical students, and this is my clinical group. And most of them are team official of BMSA Palestine. In the first photo above from right, it's me, and then Mohammed Dalo, who's the NPO, and then the National Treasurer, Firaz Akut. And in the next photo, there is Muhammad, who's the National VPI. About the three photos, which is in the right, here is the students from Al-Azhar University, from Al Quds University, and in Najah, who today and yesterday finished the last exam successfully. And they some pictures from the celebration. So graduation for them. And next, Hannah. Here is the last slide. Thank you very much. But you here see a random group of triangles with red, blue, green, and white. You may didn't understand it, but actually, this is each color stands for something. The green for the land, the blue for the blood, the black for the war, and the white for the peace, which is the colors of the Palestinian flags. And the whole structure is the olive tree, which is a symbol of the Palestine. And thank you so much.
Thank you so much, Hannah. Oh, sorry. Thank you so much, Hannah and Abdallah, for the amazing presentation. We love it. And now, for next and last, we will invite Sake to present about Jordania, even though now he is also in Palestine. So you can go next. Do you need some help to share the screen? Yeah, perfect. We are not hearing you. We can see all your screen in the computer.
Sakir, are you ready speaking? Because we cannot hear you yet. Yes, it should be working. Maybe just your computer change which microphone it's using.
Do you have a headphone or phone that you can maybe use it?
Maybe you can stop sharing the screen and then start again. Maybe when you started sharing the screen, it stopped recording your voice.
We cannot hear you.
Oh no. So we're gonna try something else. Like Sakir went out of the room, and he's gonna come back again and see if the mic goes back working. Mm. Even though we tested before, right now it stopped working.
Maybe we can, in the meanwhile, answer like 1 or 2 questions.
Yes, Buddha, do you want to start answering yours?
Yeah. Do you hear me? So, what is the question?
Yeah, so first question is, how's the process for becoming a doctor in Tunisia if you're a foreigner? Like, how do you, if you're not from Tunisia, how do you do?
Okay, it's like basically the same as the Tunisian student. I can take the example of a Moroccan student. They study the same number of cycle, but there is one difference, which is the national medical exam. They have to pass it as the only medical student, but they choose their specialty without the ranking part. Like whatever the score they had, they can choose the specialty they love, because after graduation they will go to back to work in their country. And if someone wants to work in Tunisia as a doctor after graduation, he has to marry a Tunisian woman, or she has to marry a Tunisian boy. So this is the process, but basically it's like the same as the Tunisian student.
Okay. And how common is French spoken in the medical field in Tunisia?
Yeah, it's very common in Tunisia. The main language of a medical school is French. However, in practice, French is basically for medical Tunisian dialect is used in order to communicate with the patients.
Luda, thank you for starting answering the questions. We're gonna go back to Sakura now, and then we go back to questions by the end of
Okay.
everyone's presentation. Thank you very
Yeah.
much.
Here we come.
Did you open, Juliana? I'm open the slides just a second because my computer is really slow. So it takes a while to
Okay, can you hear me now?
Yes.
Amazing. That's fine.
The only thing that is open right now is like on Google, so maybe we can try to use on Google. Okay, it's open.
Is it open?
Almost. Juliana is sharing.
Okay, I'll do the screen share then.
Oh, okay. I'll stop sharing now.
Can everyone see it?
Yes.
Perfect.
Yes.
Yeah, I'm not seeing it actually. I'm seeing it now. Okay. Thank you so much, and hello everyone. Buenas tardes. I guess tarde, something like that in Portuguese. I'm so happy to be here with you, with DENEM Brazil, and I'm so sorry for the technical issues. My bad. So basically, yeah, I'm Sakhar Rashid, SCOPRA for EMR. I'm Palestinian, currently in Jerusalem, a fresh graduate. I have left Jordan, but I have studied there like for 6 years. So it had taken part of my heart like for 6 years. And yeah, I am part of IFMSA, and today I'm going to talk about healthcare system in Jordan and medical education. So briefly, I'm going to be talking about Jordan, just a background briefly, healthcare system and medical education. Next, please. So basically, Jordan, it's kind of similar to Palestine, like in everything, in population, healthcare system, medical education. So you're gonna find like a few similarities, and for any questions I'll be glad to answer any questions at the end of the session, since I'm the last to go. So let's go and talk about Jordan. Jordan is a small middle income country with limited natural resources. The population is like 10.1 million, which is kind of 50-50, 48.5 females and 51.5 males, according to the last statistics in 2019. 30% of the population are non-citizens, which means they're not Jordanian, since it comes in kind of in the middle of the Levant countries. So it's collecting a lot, and it's hosting a lot of people around Jordan, and half of the non-citizens currently are Syrians. They were because they come from Syria to the city of Irbid, which is the city that I studied at. It's the closest city to the borders of Syria. So basically, yeah, we have 1.5 million Syrians in Jordan, which make 30%, half of the 30% of the non-citizens in Jordan. Next, please. So regarding the health status in Jordan, they say, or maybe according to the WHO, it's one of the best among the Middle East countries. And according to the latest WHO data published in 2018, life expectancy in Jordan, they said that the male expectancy life is up to 72.7, females 76, and total life expectancy is up to 74.3, which gives Jordan the rank of 85 globally. Next, please. So, as Hannah and Alan mentioned earlier, we share some things like polio and croup. Since 1995, Jordan has no recorded cases for either diseases, as Palestine, I guess they said 1988. So basically, we share a few similarities, and there was a dramatic decrease in such diseases, especially infectious diseases, since Jordan are like building up a very huge center for infectious diseases, and especially after the pandemic that hit all the globe. So they're taking care of this part recently. As for the NCDs, non-communicable diseases, it's the prevalence of such diseases are increasing with a huge note. So it's, yeah, NCDs are of high prevalence in Jordan. The most leading cause of death in Jordan comes as follows: cardiovascular disease, which are most commonly due to IHD, ischemic heart diseases, followed by cancers, neoplasms, then strokes, and other causes, which are RTA. Unfortunately, there is a lot of road traffic accidents in Jordan, and it's one of the most known countries to have in the Arab region to have a lot of road traffic accidents, unfortunately. So yeah, next, please. So basically, regarding the organizations that hold healthcare in Jordan, it's divided into 3 sectors, and each sector has its own subsectors, which I'll be talking about in details later on. So starting with public sector, private sector, and non-profit organizations, which are kind of similar to Palestine as well. Actually, we might be like 2 faces for the same coin. So yeah. So starting with public sectors, please next. It's divided into 3 subsectors, which is MOH, which is the Ministry of Health, and it makes the largest subsector in terms of size, operation, and utilization as compared to other subsectors, and it provides primary, secondary, and tertiary care. As for the RMS, which is the Royal Medical Services, and mainly provides the secondary and tertiary care services, and there are 12 hospitals, 7 general and 5 for certain specialties. For example, if I'm seeking a hospital that's special for cardio, let's say for CCU, for cardio care unit, I can like seek a RMS, since there are 5 hospitals for certain specialists and specialties. As for the university hospitals, there are University of Jordan and Jordan University of Science and Technology, which was the university that I graduated from like 1 month ago. So yeah, these 2 universities provide health insurance and services for university employees and their dependents, as well as serving as referral centers for other healthcare sectors and as teaching centers for medical students. What I mean by other healthcare sectors, it's like university hospitals are acting like tertiary hospitals. So basically, during the past 6 years, I've been seeing, maybe let's say the past 3 years in the clinical clerkship, I've been seeing like very hard and complicated cases, and I was wondering like, why is that so complicated? And it turned out to be like it's a tertiary hospital. So yeah, the most complicated cases comes to the university hospital. So I thought like, wow, is this really medicine? But no, it's like only complicated cases. So this is for the public sector. Can you please move on? Moving on to the private sector, yeah, it provides primary, secondary, and tertiary services through a network of private clinics and private centers, and as well as private hospitals, and it attracts significant number of foreign patients from nearby Arab nations. Medical tourism. For private sectors, it's like not the majority. Let's say the minority of the citizen use and seek medical attention from private sectors if it's something like super urgent, and maybe it's just close to them, which they can't or they don't have access for public sectors due to the distance. Or let's say if there is a foreigner that doesn't have insurance, they will just seek private sector, which is of high efficiency, higher quality. And if I'm paying for both public and private, if I'm a foreigner, I'm gonna go for private anyway, which is better quality and better efficiency. So yeah, can you please move on? So for the operates Ministry of Health, we have like 1,550 primary healthcare centers, 31 hospitals, 38 of all hospital beds. Like that means that the Ministry of Health makes the beds in the Ministry of Health hospitals makes 38% of the hospital beds in all over Jordan. So it's basically the majority. And then comes the military Royal Medical Service, which has 12 hospitals, and it makes 20% of all beds. Private sector runs over 61 hospitals. Yeah, they're like a lot, and they make 33% of all hospital beds. And for university hospitals, as I mentioned earlier before, there are 2 hospitals and they make 8% of the total beds all over Jordan. So basically, if you have much money, you just can build up a hospital and make it private and just earn money. So yeah, that is for the sectors in Jordan, which are the Ministry of Health, which is public, private, and university hospitals. Next, please. So last but not least, the non-profit organization, which are the UNRWA, as Palestinian mentioned earlier, and which is the United Nations Relief and Works Agency, and they're responsible for providing healthy living environment for 2.1 million Palestinian refugees since 1950. So basically, after the Nakba in 1948 and 1967, when we were like, it's in English, it's defined as air relapse, but it's called Naksa in Arabic. The UNRWA took responsibility for providing medical care and medical attention for those Palestinian refugees, and they deliver primary healthcare services throughout 24 primary healthcare facilities. Although UNRWA mainly focuses on primary healthcare, and it also helps refugees access secondary and tertiary care services as a financer and a provider, but not as an insurer. So we come to the first problem, which is insurance. If you don't have insurance, you're gonna get like, you're gonna seek attention and medical attention to private sectors, and you will end up like paying. But for the primary care, these non-profit organizations can provide you and make sure you receive and you have access to primary care healthcare. As for the KHCC, it's one of the most known in the region, in the Middle Eastern region. It's the King Hussein Center, Cancer Center. It's a specialized center for cancer, and it was built in 1997. So KHCC is a free-standing, independent, non-governmental, established by a royal decree to combat cancer in Jordan and in the Middle East region. So it's really like, it's a very known center. And if someone like, by any chance, if someone visits that center one day, you'll find like there is a lot of people coming there, like from different nationalities: Palestinians, Syrians, Libyans, Tunisians. Like, I've met many people from different countries in that center because it's one of the most known centers for treating cancer or combating cancer, let's say. And lastly, it's the National Center for Diabetes and Endocrinology and Genetics, NCDEG, which is an independent non-for-profit organization established in 1996. And it's the main goal of NCDEG is to provide high quality care, education, and training in the fields of diabetes, endocrinology, and genetics. Next, please. So for healthcare insurance coverage, as I mentioned earlier, 78% of individuals has health insurance covered by the Ministry of Health, which is the public sector. Actually, the main insurer for them, what I mean is 78% are insured, 22 are not insured, and 44% out of the 78% are insured by the main insurer, which is the Ministry of Health. So it leaves us like with 22 which are not insured, and they always pay for the private sector. The Royal Medical Service insures 27 of the population, while the University Hospital insures cover 1.6 of the population. But the 1.6 of the population, I would say they're mainly students coming from different countries, and when they pay for the university and when they pay the fees, they are by default insured medically. And the public healthcare insurance covers 7.9 of the population. So next, please. So basically, for the human health resources, and it was last updated in 2015, for every 10,000 Jordanians, there were on average 22 doctors, 7 dentists, and 14 pharmacists, and 36 nurses. So yeah. And the numbers and the figures down there are the figures that I already mentioned, which are the hospitals and the primary care hospitals and etc. Or in private. So next, please. I'd say this is the most fun part. So yeah, medical education in Jordan. Can you please move on? Medical education in Jordan, it's kind of same in the EMR region, which is 6 years of med school. Some countries has like 1 year extra, which is 7 years, but we make it, okay, I'm gonna go like explaining it. So it's basically 6 years of medical school, 3 clinical years and 3 basics. We start with basics years, preclinic, and we call it as preclinical years. As you mentioned earlier, we have like anatomy, physiology, histology, the basic material that gets you into medicine, and you hate medicine for that. Like during the first 3 years, you see like what's going on. I'm not here to learn about this. I'm here to treat patients, but you end up treating patients at the end 3, and maybe dealing with patients at during the last 3 years. So you get to know medicine like more and more. So yeah, it's 3 basic years and then 3 clinical years where you have like minors such as neurology, anesthesia, ophthalmology, ENT, and etc., and the majors, which are gynecology and obstetrics, and surgery, internal medicine, and pediatrics. So for after you graduate, which I already did like 1 month ago, I have the chance to go and to do 1 year of internship, which in some countries, I suppose in Brazil, it's like it's included during the medical school years, but in our case, it's just 6 years. You graduate and then you become a doctor, and you have 1 year of internship. So during this year, you just learn to become a doctor, deal with patients, and then you have a residency exam, and then you get to residency. I'll talk about more details in the next slide. So for further info, entrance school is super competitive and super hard, and I'm gonna say why next later on. As for the language of study, it's English. It's English, and all over Jordan we have no Arabic, but I guess in the EMR region it's only Syria and Sudan, which are not from the EMR region, but they are the only countries that speak Arabic and teach and learn Arabic in Arabic. So medicine in Arabic. So for the program of admission, it varies as follows. We have three programs, which is just a second. Sorry, my laptop is dying. So yeah, basically we call it local competitive, parallel competitive, and international. So why is it called that way? The local competitive, you start getting acceptance if your GPA is from 97 out of 100, which is high. So basically, no one gets local competition if you're not Jordanian. You have to be Jordanian to get local competition. And why it's different? Because let's say we pay for med school according to a credit system. So it's you pay per hour. If you pay per hour as a local competitive student, you pay 50 JDs, which makes it $70. $70 per hour, and we do 257 hours, which is a lot. If you multiply 257 by 50, you pay as local. And if you're a parallel competitive, as I was a parallel competitive because I'm different nationality, it was a foreign nationality, you pay more, which is 200 JDs per hour, which is 200 almost 280 US dollars, and you might buy 257 hours as well. So it's a lot. And here comes the international student. So if any Brazilian wants to study in Jordan, they will treat you as you're an international student because you're not Arab. This is first, and then you will pay 300. It was 500. Sorry, yeah, it's $500 per hour, which you multiply it by 257, and it's like million. So it's too much. So yeah, it differs, and according to what? It's according to the It's according to the degree, as mentioned down there in red. Students are classified to different programs according to their nationality and the origin of high school certificate. For example, if you're Jordanian, but you haven't studied in Jordan, you're not gonna be treated as local competitive because you're Jordanian. Yeah, we know that by nationality you're Jordanian, but you have studied, let's say, SAT, which is an American degree, or let's say IG, which is a British certificate. So you will be treated as parallel competitive and you will pay. However, we have some things in Jordan that let you pay zero, and sometimes the government pay you, which is we call it jasim. And if your father or a family member is part of the army, you will have a free spot in university, and they will end up paying you $280 per month. The government will pay you. And there is something else that's called a son of Jordanian woman. Sons of Jordanian women. It sounds like we're talking about Game of Thrones. So yeah, the sons of Jordanian women get even if you're studying abroad, you're not studying in Jordan and you're not Jordanian, but your mother is, you're gonna be treated as local competitive. You're gonna be treated like between local competitive and parallel competitive. You're not gonna be paying $70, neither $280. You're gonna be paying something in the middle, $150, because you're Jordanian, so they will be dealing with you like in a special way. So yeah, there are a lot of things that are complicated in Jordan, the way they pay, and there's something that's called a royal spot, which is one per each specialty. For example, medicine gets one spot, dentistry one spot, and etc. I guess it's according to your GPA, and there is something that you sign up for, and it's like a scholarship from the king of Jordan. So if you get it, you're so lucky to pay zero. Like through the past 6 years, I have paid $80,000 to study, which is parallel competitive. As for internship, it's free admission for Jordanians, which is the first year, the year that you do after medicine, after the 6 years. It's if you're Jordanian, you this year freely, you pay nothing, and if you're a foreigner, non-Jordanian, no matter what nationality, you will pay $4,000 to get in, and you will be paid nothing during the year. You will be paid during the year. As for the residency, there is an exam, as I mentioned earlier, and if you get accepted, like recently started, which they started like 2 years ago, they started to be unpaid. So you start residency for 4 or 5 years, no matter what residency, but you'll be unpaid, which is like it's a disaster now in Jordan. So they're just doing a lot of strikes and stuff to stop being unpaid, but you end up having like no spots or no residency if you don't get the spot. So basically, I guess that's it. And if you have questions, I'll be glad to answer them if I could. So yeah, I guess that's it. Yeah, that's it. So yeah, there is thank you in all languages. I made sure obrigado was there. So yeah, obrigado.
Thank you, Sahe. So I think now we can go to the questions for everyone. We already answered one from Loda. We can maybe continue with her questions. So Iago, can you put here?
I have answered 2 questions.
Okay, so the last one. Okay, I will read again. Aslama, I have no idea where it is. So everyone in Tunisia have access to free healthcare system?
Okay, Aslama means hi in Tunisian dialect, and I guess this one is someone who knows Tunisia. Well, I will answer the question. Aslama, yes, it is public and free, and its principle are universal, equity, and integrity. This means that everyone within the Tunisian territory has the right to be assisted. It distributes efforts according to the local necessities of each region in order to provide the adequate support to everyone needs. And every person must must be seen as a whole, owning the right to have all your questions fully addressed. Yeah, this is what the last question, I guess. Is there any other questions?
I think for now that's it, but they will send us questions during the questions, so we can go maybe to the next one. For Palestine, how is for women to study medicine in Palestine?
Well, there's no difference between women and men to study medicine. They are treated equally if that's the question. So it's the same medical education system as Abdullah previously said. Is that the question precisely? What was intended from the question?
I think that's it. I don't know. They also ask for Jordan. The university.
If they want more, please send another question.
I think we can go to the next one. The university's hospital in Jordan only serve a university's community, or do they not serve the rest of the population?
Basically, they primarily serve the university community, but as it acts as a tertiary hospital, it will serve the community because it's one of the most known hospitals in Jordan. In the upper part, which is in the north part. So yeah, basically it serves like most of the north region, since Jordan is divided into three regions: north, middle, and so it serves the northern part. As if you have insurance, as I mentioned earlier, which the Ministry of Health covers, like I mentioned, I guess 44%. If you have insurance, you're gonna be served freely. If you don't have, you will have to pay by the end of the day. But it serves anyone that comes there. Thank you.
Questions for everyone now. What did you like the most about the Brazilian healthcare system? So each one of you maybe can answer.
Well, you said that if you have a headache, they will not only check you for a headache, they will check you for everything. Maybe you have another problem. Well, that's a very comprehensive way to deliver healthcare to people, to citizens. Yes.
Thank you. Maybe, Seke, what do you think about the Brazilian healthcare system?
Can I go maybe? Is it for everyone, right?
Yeah. Yes.
I guess it's so complicated, like really complicated. As like when you do the last year, which of internship, you're not known if you're a doctor or you're not a doctor, but you're being treated as a doctor and you're being treated as a student. So it's kind of complicated. But I guess SUS, I guess that was the name of the system. I guess you said that it support and provide healthcare system for the majority. So I find this, so I find this supporting and providing healthcare system for the population is a good thing, and it's kind of near and close to the UHC universal health coverage, which we're hoping to be implemented soon in the world, and finger crossed happening like soon, inshallah. And yeah, I liked it so far. Thank you, and thank you for having us.
Loda, what do you think about the Brazilian health system?
The thing that I like the most is the fact that you have 3 levels of healthcare system, as in Tunisia, the primary, the secondary, and the tertiary one, which this, like, due to this system, you can give a chance to all the Brazilian citizens to have access to medical healthcare, sorry. And then if like there is something more specialized, you can go to, they can address you to a specialized hospital or something else. This point is common with Tunisia, and I really like it. Actually, the whole system is good, as I think. This is my opinion. And yeah, there is a lot of common points, I guess, with Tunisia, and this is something that I really appreciate. Yeah, that's it.
We have another questions for everyone again. If you could, what should you change? Well, wait, in your country's health system?
Let me think.
Can I go, please?
Yes.
So basically, maybe I can tell us a little story which happened 6 years ago when I was a first year med student. Yeah, I had a friend who was Syrian, and he was attacked by burglars in the street, like in the middle of the street, like at 2 a.m. And we had to take him to the hospital. He was bleeding, like he was bleeding from all over his face. But which sadly happened, they asked for insurance before treating him. So if I were like someone with power in Jordan, I would say to treat patients and make sure patients are safe before like asking for insurance and before asking for money, because he was literally, and till now his face is like so bad due to the delay of treating him and due to the bleeding that happened to him, like because they were only asking for insurance and money. So I would really like to treat patients and take care of them, as it's being human first, like it's what matters before asking for insurance. And I would say that only. Yeah, thank you so much.
Thank you, Sake. Hannah, do you want to go next?
Yes. Well, I hope to increase the prevalence of health centers in all towns. For example, in my town, Nablus has more health centers and clinics than the around towns. So, and the delays in access makes it harder for all Palestinians to get health care and services. So, if there is more centers, so that means there are more healthcare coverage and access to all people in the urban areas. Yes, that's it.
Okay, thank you. I think Loda it's not here for now, so maybe when she can. Oh, here.
No,
You want to go next?
Okay, thank you. The thing that I would love to change in my healthcare system is that we should provide more. We should focus more on the internal country, like not the regional cost or the capital, but we should like get more specialized doctor and more provide more materials there, and also to increase the capacity of our hospitals by providing more materials and more specialized doctors, etc. Yeah, this is like the main problem, maybe. Yeah, thank you for the question. If you have any other question, I'm still here.
Thank you. Next question is for Palestine. Do you have residents in anesthesiology? Maybe, like I think the person who asked this have interest in doing residency in anesthesiology. So maybe you can explain how is also the process of a foreign to do residency in Palestine or something.
Okay, well, I think I'm not sure about that, but if there is anesthesiology, it will be only in East Jerusalem in Maqasid Hospital, not like in West Bank per se. The process of yes, and I'm not sure about the process of residency. I need to like check it out. Sorry about that.
No problem. Next question is for Jordan. How is the foreign medical students to apply for residency in Jordan?
So practically everyone can apply. Basically, you have to make sure that your certificate is recognized by the country, by our country, because recently, unfortunately, people are just studying in universities that are not recognized internationally, and when you go to apply for residency, it's not working. Or just in case, if there is any suspicion, you have to revalidate your certificate in Jordan, like to visit the Ministry of Exterior and to the Ministry of Health to make sure your certificate is working, and then you apply for the residency exam, which is super hard, like literally super hard. And if you pass, you'll get a spot. I guess the spot you need, the spot you want, but you will end up paying, I guess, at the beginning. I'm not sure how much you pay because I wasn't so interested in doing residency there because I'm back to Palestine. I'm gonna be doing here because I live in the Israeli part of Palestine, which is it's not the Israeli part actually, but the hospitals around us are conducted and held responsible by Israelis. So it's technically Israelis universities. So my residency will be here. So about the residency, like to be specific, how much they pay, I'm not sure. But you have to revalidate your certificate and you have to make sure to pass the exam. And good luck with that.
Okay, thank you. So next questions, I guess, is for everyone. And how has the fight against the COVID-19 pandemic been in your country?
I can go first if you want.
Yes, please.
Okay. For Tunisia, it was a struggle, but quite safe. Like the medical staff was motivated. There wasn't a lot of cases. I guess like for now, we have only 1,100, almost 100 cases, like 1,100 cases. For the thing that we didn't have a big problem with the fact that the situation wasn't so terrible in Tunisia is that we started preventive measure since our 10th cases. So like the country was locked down, we stopped school and everything, and people like were and they did understand the situation, and they followed the measures set by the government. So yeah, this is the and also we didn't have a problem of we didn't have lack of materials because of the number wasn't so high. For now, we still have cases, but most of them are imported. Like now, we don't have new local cases anymore. Yeah, I think this was the question. This is what the answer, the right answer for the question. Yeah.
Yes, thank you. Next one, please.
Can I go?
Can I go next? Okay, Hannah, go.
Okay. Well, we started quarantine and lockdown on the 1st of March, and it took like 3 months, and we had everything under control. Somewhat left off the quarantine and lockdown, and it took 2 weeks for the cases to start rising again. So now we are back to lockdown. We have shortage of equipment, and the economy is really affected. But it's like a good thing that the cases in Palestine are not that severe, like tens of cases are only in the ICU. So it's kind of bad, but not that bad. Like in Italy, it was a very bad, severe cases. Yes, that's the answer.
Thank you. Okay, next.
Thank you, Hannah. So in Jordan, I guess 2 days ago, I saw an article which had both Jordan and Tunisia as the first as the best 10 countries, or the best 10 countries that are dealing with the COVID-19. It's been like 3 weeks since we had no cases. All the cases, like Khulud said, they are only on the borders. People who are coming to Jordan are being tested, and then they are quarantined, like in hospitals that are super special and specialized for COVID-19 positive patients. There are no local infected patients, or no locals at all. And if you're wondering why, because in Jordan there is something called the defense law, which is literally I had a tank like 50 meters away from home, and if it's a tank, yeah, it's a tank, a real tank. This defense law, if it's implemented, it's kind of a war zone and a war time, so you can't go out, and a specific time when you have to go out, and specific time when you like at home. So for now, Jordan is dealing with a quarantine, which is from, it's not quarantine, but it's a curfew from 12 a.m. till 6 a.m. And they started like 2 days ago to wait for 10 days of 0 cases. If all is good, they will just make it free for all the day. Tourism is back. Medical system is so stable, and they've been stable like for 1 month now. And now they're trying to make something which is they are dividing and classifying countries into 3 zones. That's what they said recently. It's a black zone, I guess, red zone, and green zone. Which black zone, which is, or black code, no countries from this zone can't come to Jordan, like for traveling and tourism. Red zone can come to Jordan. They will be quarantined for 2 weeks. And green zone, you have to get a test of corona free. Like you have to be corona during the past 72 hours before departing to Jordan. So far, Jordan is so safe to visit, and so safe to have fun in. So you're all welcome to Jordan whenever you want and wherever you want. So thank you.
So thank you guys for the amazing presentation you all did today with us, and thank you for support our idea of the webinar. I want to say thank you for Shakir, to Hannah, and Abdullah, and Loda for the presentation. And if you want to say something else, just so we can end here, because maybe it's getting too long. It's up to you.
So thank you so much, everyone. Obrigado. And hopefully life is back. Thank you so much. Have a good night.
Thank
you so much, guys, for the invitation and for attending this webinar. I can't wait to see you in another opportunity. And also, you are welcome to come to Tunisia, as it's a safe country and it is COVID-free country. Thank you so much.
Hopefully we'll see you in Palestine too.
Thank you, guys. You're all welcome in Brazil when things get better too.
Thank you all for joining us. Yeah.